Hey there, today we're going to be doing the wound check-off. The first thing I'm going to do is read the 12 safety practices. It's verify the order. Then you're going to do hand hygiene before and after. You're going to verify the manufacturer's policy. You're going to verify the policies and procedures, and then gather your supplies. And then you're going to knock on the door. Use 2 patient identifiers to identify the patient. You're going to note the overall condition of the patient, explain the procedure to the patient, and then you're going to lift the bed for good body mechanics, and then lower it when you're done, and then PPE if you need it. And then if I find anything abnormal, I would report it to the charge nurse, and then lower the bed when you're done. And then make sure they have the call light and that stuff. So the first thing I'm going to do is put on some gloves so I can undress the patient's wound. So if the patient had a dressing on her wound, I would untape it and pull it away from the patient, and then I would note the wound, noting if it has any drainage, or making sure it's red and granulous tissue, making sure there's like no subcutaneous tissue, and then, like I said, the drainage and the overall condition of the wound. And then I would clean the wound, so I would just take some gauze. And I just have 2 pieces right here, and I would just clean the wound from top to bottom, and then throw it away, and then just making sure it's extra clean, and then throw it away. And then I would like note the condition of the wound, and making sure that it there's no tunneling and undermining, and making sure there's no excess drainage or slaw or anything like that. Next, I'm going to measure the wound. All right, so it looks like it is 1 inch in length. And then at the deepest point, at the widest point, you're going to measure the width, and it looks about 1 inch as well. And then I would take a Q-tip, and I would feel around in the wound, again checking for undermining and tunneling, and then checking to see the deepest part of the wound, and it's like about this. And that is about 1/2 inch, and I would discard of this. And then I think I'm done with that, so I would take off these gloves and throw them away, and then I would start to prepare my sterile field. But before I do that, I would measure the tape to make sure that I'm not using excess tape. And once I'm done making sure I have enough tape, I would label them with my name or my initials, and the date and the time, just so the next person knows I changed the wound and what time I changed the wound. So then I'm going to prepare my sterile field, and I would open it away from me, making sure I don't ever cross the sterile field, and leaving a 1 inch border. And then I would take the gauze, making sure I open it away from me, and then I would pour it on the sterile field, making sure I do not touch anything. And I would discard of this. Then I have saline, and I would palm the label, making sure it didn't expire or anything, and then pour over my sterile field, making sure it's not too high or not too low so it doesn't splash. And then I'm done with my saline. And then now that I'm done with that, I'm going to prepare my sterile hands. So I have my gloves here. I know there's a 1 inch border, but my table is kind of small. So I would just open my gloves, and give it a pop so that I am not dealing with the edges. And then I would cuff my dominant hand first, and then my non-dominant hand. And then I fix them because it's sterile to sterile. All right, then I'm ready to pack my wound. When you have sterile gloves on, you never put them behind, never lose sight of them, and never below your waist or above your shoulders. So I'm ready to pack this wound. I have some wet gauze I would just pick up and fluff. Here I go. And then I also have Q-tips provided that I would take, and I would pack. I would make sure that the patient's not in any pain when I'm doing this, and I would just pack the patient's wound. Having a hard time packing this patient's wound. Okay, that's about as good as it's gonna get. And then the sterile part is over, so the next thing I would do is take the bandage, and obviously this bandage is way too big, but I would make sure that the bandage would cover the wound completely, and then I would tape it down. And then also initial and date and sign the the thing if I need to. And then I think I'm completed.